I think the important thing that we need to be wary about is not assuming the patient has an understanding of normal menstrual function and fertility in terms of fertile periods of the cycle. I have many, many women who don't actually know when they can get pregnant in their cycle. This might have been taught in middle school sex ed class, but I'm not sure most of us were really listening or paying attention. And now we have ovulation predictor kits for sale in pharmacies. We have ovulation predictor apps. The public is more educated, but never presume as a clinician, never assume that your patient really understands when during her cycle she's most fertile, because it's very frustrating for patients or couples to come in and say, we've been trying for 6 months or 6 weeks or 6 years and we haven't conceived, and they've been having sex during the menstrual cycle wondering why they weren't conceiving. Also, it's important to educate patients as to the age-related decline in fertility. I think women understand that, couples understand that, but we as clinicians need to understand, when does egg quality go down? When is it appropriate to refer to a fertility specialist? When should you first start by saying, have you seen an OBGYN? Have you gone to your OBGYN? Some women don't go to an OBGYN regularly. Some women only go to an OBGYN. And I think 25% of women nationally only use an OBGYN. They don't have a primary care physician. But even those women should also be in the hands of a primary care physician. Do they have hypertension? Do they have other comorbidities that may impact their ability to conceive or pregnancy? And this goes for their male partner as well. But taking a good history is critical in terms of who's your partner, has your partner fathered children before, has, trying to uncover red flags that might indicate either a male factor, which by the way is responsible for 40% of infertility, or a female factor in infertility. So these are just things, as a clinician, if a patient comes saying, we're trying to conceive, we're having issues, a good history is critical, a good history that could uncover some causes, but also a good basic understanding of ovarian function and how fertility relates to your age, your medical history, and when you and your partner are having sex.